και να ζητήσω από τον κύριο Couespel να... you can take the podium, the floor, να μας μιλήσει λίγο για τις επιδόσεις, αν θέλετε, της Ελλάδας στο πεδίο της διαχείρισης του καρκίνου. Θα μας δώσει κάποια ενδιαφέροντα στοιχεία.
Thank you very much. Good afternoon. So it's a great pleasure to be here today, as mentioned by our Press President Andreas just before, to officially present our European Cancer Pulse and in particular our new country report for Greece. So I'm sure that nobody in the room will question as a starting point that inequalities do exist, and many inequalities do exist in cancer across Europe and across social groups in different countries. And data on these inequalities, as mentioned just in the previous intervention, is crucial to drive policy. We know that multiple stakeholders in Europe are working to try to quantify these issues and try to drive attention to it. But unfortunately, all of that information is frequently not brought together in a single place. And these sort of evident gaps, as we know, can drive implementation gaps when it comes to cancer policy. So as a response to this situation, at the European Cancer Organization, we have been developing a tool called the European Cancer Pulse, which we have been developing as an interactive data visualization tool to precisely track inequalities in cancer. So the tool at the moment includes over 170 data indicators across 50 European countries. And as you can see on the slide, it really aims to cover a whole breadth of all the sort of issues that you can have in terms of access to cancer prevention, care, and also cancer policies. What the tool aims to do is first to gather this information precisely. We know that information is frequently fragmented, so try to bring it all together in a single place. It also aims to really shine the light on all the work that is being done in the cancer community when it comes to cancer inequalities. And last but not least, it aims, of course, to trigger action. I think the previous presentation by Andreas was really highlighting the need for action in cancer policy, and this is very much what we are aiming to do. So right now, at this point of the presentation, I'm going to try something slightly ambitious, which is going to be a live demonstration of the tool on screen. So if you just bear with me for a second as I make the switch, and hopefully everybody can see that just well. So you can now see how the European Cancer Pulse looks on our website. This is accessible at europeancancerpulse.org. And so this is this interactive map, and you can essentially click on any country, of course, taking Greece as an example, and you can then navigate across all of the indicators that are available on the platform. So for instance, we will start here with cancer burden, and you can see the incidence rates that are recorded for Greece. But we can, for instance, check cancer diagnosis here, and you can see, for instance, the number of CT scanners or PET scanners available in Greece. As mentioned before, inequalities are, of course, differences between countries, but also within countries, among social groups. And I think since we have arrived here, the special geography of Greece and the impact that it has on access to cancer prevention and care have been really something important. So in this regard, we have, for instance, information on how the place where you live can impact your access to cancer prevention and screening, for instance, so the differences between rural and urban areas when it comes to cancer prevention or cancer screening, for instance. Most importantly, and since last year, the tool has now a function to compare countries between each other, so to really to benchmark where countries stand when it comes to achieving cancer policy goals. So an example can be taken for breast cancer screening, for instance, and you can see here directly a heat map, and we're very happy that this reflects Greece's commitment to have an organized breast cancer screening program, and you can see that on this heat map, Greece is clearly within the average of the EU in that respect. And here we can see this in the form of a bar graph, and you can see Greece appearing here, so right in the middle in terms of other countries in Europe. Of course, we have other aspects on the tool, and another example we can take is about nursing. And so in that respect, that really echoes the problem of a cancer workforce crisis across Europe, which we know is a reality for many countries. And unfortunately, in that respect, we see that Greece ranks the least performing country when it comes to the number of nurses in the health system. And again, that can be converted into a heat map, as you can see here. switching back to the presentation, so we know that this European Cancer Pulse is a lot of information, precisely, and the goal in the end is to trigger policy action. So in that respect, we thought that it would be important to bring together really the key messages from the data for each country. And so this is why we are currently producing a series of country reports, which are these one-page fact sheets, including key national data from the tool, comparing it to European averages. They're, of course, very much relating to the campaign that we are conducting, that my colleague Andreas was presenting just before, and then produced together with local stakeholders. You should all have on your tables, thanks to my dear colleagues, a copy of a Greek translation of this report. And in that moment, I take the opportunity to thank ΕΛΛΟΚ and George in particular for their really great support in producing this document. So just going through some of the key messages from the document, I'm sure it will be no surprise to anybody in the room that obviously cancer is a major public health concern in Greece. As you can see, it's the second cause of death, and the percentage of deaths to cancer in Greece is significantly higher than the European average value. When it comes to cancer prevention and screening, it is great to see a reflection of the ongoing efforts of Greece to align with European and international goals when it comes to gender-neutral HPV vaccination, for instance, or breast cancer screening, as mentioned before. Of course, on the contrary, there could still be efforts being made and attention being given to such aspects as tobacco prevention, which was mentioned just before, or colorectal cancer screening, where we see that Greece is performing on average less well than the EU. As mentioned just before, the cancer workforce crisis is a reality for all of us across Europe. And obviously, the country report reflects that when it comes to the number of nurses per 100,000 inhabitants in Greece, with Greece being 2.5 to 3 times lower than the EU on that aspect. And finally, and I think this is a very timely slide given what we have been hearing just a few minutes ago, we think that every country in Europe should have a national cancer plan and a cancer registry. So at the moment, the country report was saying no on these elements, but we heard just before very positive news in that respect, so we'll be delighted to update the report to reflect all of these positive developments that we have been hearing just before. Last but not least, the work doesn't stop here, and obviously in many areas, we know that more information is required to really capture the issues. And so in that respect, at ΕΤΗΣΙΟ, we are currently conducting 2 important surveys to both look at the working conditions among cancer professionals across Europe in relation to the cancer workforce crisis, and also to capture perspectives from survivors and caregivers across Europe to really have them on board as we implement a significant element of Europe's Beating Cancer Plan. So you can see the surveys on the screen with a QR code, and we would be very grateful if you could support us in disseminating these important initiatives to your community and networks. Thank you very much, and you can find my email address on the screen for more information.